Well, Amari Stopes International is a global sexual and reproductive health care provider. We provide quality family planning and reproductive health care, both here in the UK and in 43 countries around the world. We served last year in the world 6 million clients altogether. That was a 20% increase over the previous year. So we're not just a large organization in our field, but we're a growing organization. We estimate that in 2008 we prevented 7 million unwanted pregnancies, 1.9 million unsafe abortions, and that these combined helped to reduce in the countries where we operate maternal deaths by 6.6%. So we're a large organization, we're a growing organization, and we're an organization that is and aspires to be a global solution to the problem of 200 million women in the world who say they want access to family planning and don't currently have it. Well, I would say that the spine of our global programming is really comprised of our 600 MSI owned and operated clinics. There are 9 such clinics here in the UK. There are hundreds more in some of the most remote areas of the developing world. But in every case, they provide a full range of family planning services to women. We have our own clinics, but we also form outreach teams that take the services away from the static sites into rural areas and into urban slums, which is really where all of the unmet need and the underserved populations for family planning and reproductive health are. And so we have our own clinics, we have our own outreach teams, but we recognize that as one organization, we can only do so much on our own to address this massive need of 200 million women. So we're increasingly engaged with other providers in the areas in which we operate. We go into underserved areas. We identify other private providers of quality reproductive health services. We provide training and support to those providers. And then as they begin to deliver services at the same standard that we would deliver them ourselves, we mark them with a mark of quality known as the Blue Star. We network them with other quality providers so they can exchange best practice and information. And they become an alternative network of quality providers for women. So they have our own clinics and they have other private providers providing the same services. We're also increasingly engaged with governments. So governments in many places are now contracting us in to help manage family planning service delivery in government facilities. They're also contracting out to us to, for instance, carry out this family planning service delivery in rural areas and urban slums. But all told, we use a sort of health systems approach to ensuring that women have maximum access to quality services when and where they need them. But that's just on the supply side. Briefly, on the demand side, we're also engaged in some innovative ways of supporting women, particularly low-income women. We're innovating with demand-side financing, whereby we put vouchers into the hands of low-income women. They can take those vouchers to any one of a number of qualified providers. They can receive a quality service free of charge to them, but the provider can then redeem that voucher to a management agency and get reimbursed for the service. So it's good for the woman, it's good for the provider, and we think it's good for donors because donors know that their subsidies are reaching, first of all, low-income women, and being used on a results basis, meaning nothing is paid for inputs, but rather paid for outputs and for outcomes, which we all strive to achieve. So it's a health systems approach to family planning and reproductive health care, and I think it's unique. Well, the changes in Washington certainly haven't hurt our cause and haven't hurt us as an organization, and in fact they're just beginning now to help in very tangible ways. You may recall that in the last months of the Bush administration, the Bush government banned US-funded contraceptive supplies to 8 MSI programs in Africa, and this had a seriously negative impact on our ability to service and provide services for women in those places. The Obama administration wasted no time upon taking office in January in rescinding that ban and starting the flow of commodities to those programs again, and now all of those programs are again receiving US-funded commodities. But they also, in general, have just become allies rather than enemies of women and reproductive rights. And given their influence in many places in the world, again, that certainly doesn't hurt and is beginning to help in profound ways. That said, we haven't yet received any direct US funding for our programming, but we remain hopeful that that will come in time.